Hello everyone. So NEET results have just come out yesterday and a big congratulations to all of you who have gotten a good rank. You deserve all of it. You have worked really hard for it and now let the feeling sink in. I hope you enjoyed your result yesterday, shared with your family and friends, and best wishes for your future upcoming clinical branch. However, INI-CET is just around the corner and the exam is to be scheduled on 7th May, and I'm frequently getting a lot of requests from students. So what should be the strategy for my INI-CET exam? And you guessed it right that INI-CET is a very strategized exam. You need to make a very good strategy how to complete all the 19 subjects in these given time between NEET PG and INI-CET, and all of you should give INI-CET even if your NEET PG exam went bad, even if your NEET PG exam went good, or even if you have no idea whether you should give INI-CET or not, still you should give INI-CET. So in this video, I want to tell you how you can strategize your whole preparation, what should be your resources, how to plan individual day-wise schedule. I'll give you a framework. You can make it on your own. You can plan it on your own. Take this video just as a guidance to how to prepare for an INI-CET. Okay. So at the outset, let me just tell you that INI-CET is the most doable exam to crack. It is, in my opinion, more easier to crack than NEET PG because INI-CET relies heavily on previous year questions and previous year topics. Like I can at the back of my mind tell you that there are these 100 to 150 topics that you have to read and revise again and again, and around 100 questions or 100 to 120 questions will be asked from those 100 to 150 topics. So it is very strategized, very PYTs or PYQs heavily focused exam, and hence these are the cornerstone of your INI-CET preparation. As I said that there are some limited topics which are asked again and again, and we'll discuss how you should plan your study. So 3 pillars of to crack an INI-CET, in my opinion, is a concise material, doing previous year questions. PYQs are very important for INI as compared to NEET. NEET also relies heavily on PYQs, but not as much as INI. INI तो पूछता ही हमेशा प्रीवियस ईयर टॉपिक्स है, वही सालों साल से जो मेरे टाइम पर पीजी एंट्रेंस के क्वेश्चन पूछे जा रहे थे, सिमिलर टॉपिक्स ही अभी भी आ रहे हैं, एंड अ वेरी गुड रिविजन. सो INI is tricky in the sense that it asks you some confusing questions which involves multiple subjects. So there will be a radio correlate, there will be a surgical correlate, there will be a pathological correlate, and then they'll form a question and its options. The main trick the examiner plays in INI is to make the options confusing. So which of all of the following are correct except which is not the treatment that you will give, which will be the next best step. So a lot of it is conceptual, a lot of it is clinical, and hence you cannot read everything. The main focus of your INI PG strategy for you now should be whatever you have read, just consolidate. Remember this keyword, consolidation. You need to consolidate whatever you have read for your NEET PG into a system which you can rapidly recall in the examination hall. So I'll tell you how you should do that. So first, coming on to the concise material. What should be the material first that you should revise in these? Let's say around 53 days, around 2 months that time we have. Now this concise material can either be your revision notes, which you had revised for the last minute in NEET PG. If you haven't made your revision notes, there are revision notes available in the market of various coachings, various apps. You can use those. If you have joined a TND and made revision notes in that TND, use that as a base. Or if you have your own concise notes of a subject, it is the best resource in my opinion because you have already filtered down the important topics. If you do not have any of these and you are looking for a concise material, especially for a first and second year subject, I recommend First Aid is a very good book in that aspect. So the first building block of ours will be a concise material. Okay, a concise material. And over that, how will we augment this concise material? We will do previous year questions. Okay, and to consolidate everything, we'll do a good revision. And that's how your whole 19 subjects will get consolidated for your easier recall in the exam. So how many years of PYQs? In my opinion, the best ideal number of years is 5 years. That makes it 10 papers, 10 papers of both INI and AIMS PG. PGI paper, if you have time, you can do, but AIMS PG and INI-CET paper for 5 years, you should do at least 3 years. Okay, at least 3 years, that makes it 6 papers. Okay, which makes it around 1200 questions minimum. And if you're doing 10 papers, that makes it around 2000 questions. Okay, so these much questions are sufficient. And since you are doing previous year questions, you'll get to know which are the topics that they're frequently asking again and again. And it will give you confidence that whatever you're reading is relevant or not. So doing PYQs for INI is a must. Okay, you must take this from this video. Now, a word about first aid. Why I mentioned first aid in the list of concise material. Now, a lot of people do not like first aid. A lot of people do not like people who promote first aid. But believe me, I did my MBBS from AIMS. And when I gave my first PG entrance exam, that is, I gave November AIMS PG. In that preparation, in that time, I did not prepare. I did not have a very good preparation. And only one subject I read from first aid, that is biochemistry. And I did not read a lot of things because internship was hectic and I was not in a physical or in a mental state कि इस साल एक PG crack करनी है. And what I realized during that time while reading biochemistry from first aid in November attempt, that it is a very complete book, especially for your first and second prof. It augments knowledge from various other subspecialties as well. Okay, so the way it consolidates your already read material is super good, and no other material, no other coaching, no other sort of notes available in the market do it to such a good precision. So for example, these are the tables that are given in first aid. This is a microbiology and this is an ECG table. And you'll see that within a page or two, they'll cover a big topic. So for example, lymphoma, Hodgkin's, non-Hodgkin's will be covered in 2 pages. ECG will be covered in a single page. Lysosomal storage, glycogen storage, types of lipoproteins, they'll be covered in one table. Similarly, STIs in gynae will be covered in one table. So you'll get to know that how you can do a quick revision. And believe me, since the topics that are asked in INI are similar, the whole game becomes whether you are able to recall those important topics in the exam hall, and you'll only be able to recall those topics if you have revised them again. Okay, so the 3 key pillars that I told you in the first slide, concise material, are linked to each other. So if you have a concise material, you'll be able to revise it quickly in the exam hall. And how will you know what are the concise material that you have to read? By doing previous year questions. Okay, so these 3 things form the basis of your INI-CET strategy. All right. Now, some people ask me that if you haven't read first aid till now, should you read first aid? So my answer to that is a resounding yes. Even if you haven't read first aid, you have read your coaching material now for your NEET PG. Reading first aid will just consolidate that knowledge. Okay, so let's say you're reading biochemistry now. Do previous year questions. Do previous year questions of last 5 years. It will take you 1 day. It will take you half day. Let's say just read the question. Don't read the explanation when you are doing PYQs. Yes, it's a very important point. While doing PYQs, do not read the explanation. Question, answer, move on. Because your whole point of PYQ is to know the important topics. All right. In a half day or 1 day, you did previous year questions. Then you read your RR notes. If you don't have your RR notes for first and second prof, especially microbiochemistry, pathology, pharma, read first aid. You'll realize that most of the previous year questions and topics are covered in first aid, and whichever are not covered, you can annotate it extra into the first aid then and there, so that it becomes a very, very handy tool for your last 10-day revision. I'll talk more about the last 10-day revision in the next slide, because I think, in my opinion, that is a game changer for an INI-CET exam. So for biochemistry, micro, psyche, pharma, hematology, and general pathology, micro, etc., etc. I think first aid is a very concise material for you to consolidate your knowledge. Okay, and if so, the sequence of your preparation can be first do PYQs along with some revision notes. If you want to do revision notes first, you can do revision note, but make sure that those are small enough for you to revise in one day or a day and a half. The remaining half day you do PYQs, and then just read first aid, and you'll realize that almost all the things that are there in the PYQs have already been mentioned in first aid. Just add extra things. So this becomes your consolidated, concise material to revise in the end. As I said, FA is a very good resource for micro, biochem, pharma, path, biostats, and psychiatry. Medicine, when you are reading, especially for INI, just focus on emergencies. I'll come to that in a bit. When about the systemic medicine, let's say endocrine, respi, cardiovascular, rheumat, read it along with first aid systemic studies. So in first aid, you will see that when they're discussing, let's say, cardiovascular system, they'll go from anatomy to physio to path to pharma. So a lot of medicine already gets covered. Whatever extra you need to add, just do previous year questions of medicine and add it in the first aid then and there. Okay. So what should be the timeline of your study? So if today is 15th March, your first reading should end by 20th April. Okay, so the first cycle of reading should end by 20th April by just doing RR plus FA plus your own concise or your own concise notes plus PYQs. Okay, you have to study 10 hours a day, at least 8 hours. So I think you can study during this time because you've already had a week break after your NEET PG. Okay, so study for 8 hours at least. You'll be able to cover majority of syllabus of that particular subject. On 21st April, you give 1 GT. Does not matter what your score is, whether you perform good, whether you perform bad. The whole purpose of doing GT at this point is to acclimatize that, yes, in 3 hours, I have to do 200 questions. All right. From 22nd April to 6th May, here is when you will do your final revision. When you will do your final revision. And this is the last 15-day or 10 to 15-day revision that I always talk about. And here, just do notes. So if you have annotated things on first aid, read first aid at this point. If you have not used first aid, try to read RR, your revision notes at this point. Do not give GTs. And in my opinion, even PYQs. So you can do PYQs of subjects you haven't read. So let's say some minor subjects you completely left out. PYQs of subjects you completely left. So for example, ENT, ophthal, anesthesia, these are small subjects for which you did not have time. आपके पास time नहीं था इनको पढ़ने के लिए, तो लास्ट का जब आप रिवाइज कर रहे हो, इनके बस PYQ कर लो, एटलीस्ट लास्ट 3 years के, 5 years के कर सकते हो तो बहुत बढ़िया है, 3 years के एटलीस्ट कर लो 6 papers, question answer, don't read explanation. ठीक है, last final day revision, you try to read all 19 subjects because that will make the whole syllabus fresh in your mind for a very ready recall. So this is the whole timeline. We'll try to finish everything by 20th April. That is a month from now, more than a month, around 35 days. And then a final 10 to 15-day revision just before the exam. Now, which are the high yield subjects at this point that you should focus on? So broadly speaking, first, second prof, minors, gynae, surgery में breast trauma, general surgery, hepatobiliary system, medicine में emergencies, peds में general peds, especially immunization, neonatology. In a nutshell, and biostats. In a nutshell, this is the whole outline, but especially which are very high yield, micro, biochem, anat, pharma, In pathology, I think hematology and neoplasia are the most important subjects. Rest of the pathology, you can read while reading first aid because a lot of it gets covered there. FMT, in my opinion, is a very, 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 very BTR, very important subject that you should read because it will take you 1 to 2 days and it will give you 7 to 8 questions. And you'll only be able to correct them if you have read them because a lot of it is mugging up. So you should invest in FMT. It will up your score definitely. Obs Gynae, very, very important, especially Gynae part. AIMS is obsessed with gynae questions, CA cervix, CA endometrium, CA vulva, STIs, Mullerian anomalies. AIMS is obsessed with gynae. Derma, very high yield, especially images. Biostats, very high yield. CCM, unlike NEET PG, AIMS INI focuses more on biostats than core CCM like programs. So biostats, you can only read biostats in CCM at this point. If you want to do medicine, try to do emergencies only. Systemic medicine does not really yield a lot of output as compared to the input that you put in, especially acid-base balance. You should try to do acid-base balance. You'll definitely get 1 or 2 questions from it. ECG, 1 short question you'll get. Pneumothorax, cardiac tamponade, pleural effusion, definitely 1 question. SAH, ice intracranial bleed, stroke, most likely 1 question you'll get. Trauma to aega hi aega, you'll get 3 to 4 questions from trauma, hands down. Breast, you'll get 1 to 2 questions definitely. General surgery, 5 to 6 questions you'll get. So these are very high yield topics and subjects which you should focus on at this point if you don't want to cover the entire 19 subjects. So this is a brief outline. What should be your timeline? So for major subjects of first, second prof like micro, biochem, pharma, path, anat, and obs gynae final prof, 4 days per subject. So that makes the total 24 days. And for the remaining subjects like surgery, so I've only given 3 days because only few topics of surgery are important for INI. Okay, I've already mentioned it. I'll again write it. Trauma, breast. Trauma is head to toe trauma. Okay, breast, thyroid, general surgery, and hepatopancreaticobiliary surgery, mainly gallbladder. FMT, very, very important, I think. 2 days. Derma, 2 days. Biostats, 1 day. Emergencies, 3 days because you'll try to read both surgical emergencies as well as medical emergencies. Ortho, 2 days. You should invest in ortho because unlike other minors and other questions with other clinical subjects which have moved on to clinical based scenarios and questions, orthopedics still ask some ratta wale questions. Psychiatry, very high yield. And physiology, if you have time, you can invest in graph, especially because image based questions will be asked from physiology, especially graph based questions. Try to do it from first aid or any other source. So this is a brief outline. You start with first and second year subjects when you are starting your preparation. Let's say you want to start with biochem. Biochem is a very good subject to start with because it's a big subject. A lot of questions will be asked. Around 17 to 18 questions from biochemistry will come. And first aid, in my opinion, is a complete book of biochemistry for biochemistry. Mix minor subjects in between. For example, after biochem, you can do dermatology. It's an easy subject. Then after dermatology, you can do obs gynae, one of the major subjects gets covered. And then you can follow a series of minors, let's say FMT, orthopedics, psychiatry, etc., etc. When you are doing path, pharma, and micro, try to read the relevant medicine topics along with it. Okay, so for example, if you are reading inborn error of metabolism and biochemistry, try to cover it from pediatrics as well. Okay, so if you are reading, let's say, STIs in micro, so the vaginal infections that are asked in micro, so try to cover it from gynae point of view as well. So that is how an integrated fashion you should study at this point because you have already covered the core theory for your NEET PG. Now is your time to consolidate your knowledge, all right? For major, start with gynae, move on to biostat, general surgery, emergencies, and finally peds. Any subjects that you can leave. So if you don't have time, if you are running short on time, so you can leave radio, you can definitely leave ophtha, ENT, anesthesia, and even pediatrics if you don't have time. In pediatrics, general peds, especially immuno and neonatology are very important. other pediatrics gets covered some way or the other in, let's say, radio, let's say community medicine, etc., etc. But if you don't have time, you can leave these subjects. So at the end, I would like to say that it will be a tough journey because you have just cleared your exam, and some people don't have this motivation to study for another exam. They think कि हमें करना ही नहीं है INI, हमें जाना ही नहीं है INI, हम खुश हैं NEET PG से. But I'll tell you that INI is an easier exam to crack. You have better chances of getting a good rank in INI because there are limited topics which they focus on, and they want you to read them again and again, but read them completely. Okay, so all previous year topics should be read completely, but should be read again and again. Do previous year questions. If you don't have the motivation to do anything right now, start with previous year questions. ठीक है, अगर बिल्कुल ही मन नहीं कर रहा है पढ़ने का, जो भी ऐप है अगर ऐप कर लो, अगर कोई नोटबुक है प्रीवियस ईयर क्वेश्चंस की, कोई बुकलेट प्रीवियस ईयर क्वेश्चंस की, तो बस बुकलेट कर लो, बट अभी प्रीवियस ईयर क्वेश्चंस कर लो. Call your parents, keep them in the loop, remain relaxed. Abhi, the good thing is that NEET PG result has already come out. So if you've gotten a good rank, now you should definitely give INI because you already have a plan B in place. So अगर INI में अच्छी रैंक आ जाती है तो you get a chance to get trained in a central institute, and believe me, it will be a life changer for you. You will make very good alumni. You will get to meet amazing professors, which will remain in your contact for your life. So try to give INI-CET with a relaxed mind, and you'll perform well if you're relaxed for INI. Discuss strategy with your seniors, your friends. If you have any queries, you can DM me or ping me on Twitter and Instagram. I readily reply there. And in my opinion, INI-CET is a much easier exam to crack than NEET PG. I got a rank of 470 in NEET PG and a rank 4 in AIMS PG. So I think that there are limited topics which INI asks again. You have to be thorough with them, do previous year questions, and do revise everything in the last 10 days. Okay. So that's it from my side. Thank you and have a nice day.